Judge Andy Brown, calling to order the Travis County Commissioners Court meeting along with City Council. It is May 18th, 2021. It's 9:05 a.m. And go ahead, Mayor.
Judge, thank you. And again, Court, thank you for allowing us to join with you. Steve Adler, Austin Mayor, convening our special joint session here with Travis County Commissioners Court. Tuesday, May 18th, 2021. The time is 9:05. You have quorum present. Judge?
Mayor, I have a knock-knock joke for you. Knock-knock.
Yeah, but I'm sorry?
I have a knock-knock joke for you. Knock-knock.
Who's there?
Orange.
Orange who?
Orange, you glad we're doing another joint session?
It's a dad joke.
A little more practice with
Mayor,
this before we meet next time. We'll talk about this, young man.
All right, so we'll start off with the normal run of things where we hear from Dr. Escott, and then is it just Dr. Escott, or do we have Director Hayden Howard still?
Adrian Sterry.
We have Adrian today. Okay, we're going to hear our briefings, and then we'll go through questions of the Commissioners Court, and then we'll go through questions of City Council. Try to keep it to one question each if you can in the interest of time. But first, let's go to the Travis County comment line. Are there any callers here today? Larry.
No mention of Orange.
No, at this time we have no callers, sir. Thank you.
Okay. All right. Dr. Escott, if you are ready, please go ahead.
Thank you, Judge Brown. Before I get started, I would like to welcome Dr. Desmar Walks, who is joining us today. Dr. Walks has been appointed as the permanent health authority and will hopefully expectedly be confirmed on Thursday by council and next week by Commissioners Court. She has served the past 13 years as the health authority in Bastrop County, and we're certainly excited to have her joining the City of Austin team. Dr. Walks, I don't know if you wanted to say a few words, but the floor is yours.
Good morning, everyone. Thank you, Dr. Escott, and I'm really excited to join the Austin Public Health team and this team of individuals who have worked so diligently to curb the spread of COVID-19 in this community and have done some amazing things in public health. I look forward to working with each and every one of you. Thank you.
Thank you, Dr. Walks, and again, excited to have you. I'm going to move over to my slides. But just give me just a moment. There we go. Again, thank you, Judge and Mayor Adler, Commissioners Court, and City Council for the opportunity to update you all in a joint session, which we most enjoy, on our COVID-19 update. So I'm showing you here our update and our progress towards herd immunity in Austin and Travis County. You can see that we now have 40% of our overall population who is fully vaccinated, another 13% partially vaccinated. So 53% of our entire population is at least partially vaccinated, which is fantastic progress. We have another 6% of individuals who have a confirmed case of COVID-19 and an estimated additional 13% that had COVID-19 but was not diagnosed. And that's based upon some modeling from the UT Modeling Consortium. So that leaves us right now with at least 28% of our community still vulnerable to COVID-19. Again, these numbers assume no overlap between vaccinated individuals and individuals who had COVID-19. There's obviously going to be some overlap. So at least 28% of folks have neither a vaccine nor a history of COVID-19. And I'm going to talk a little bit later about the importance of individuals who have had COVID-19 to get vaccinated. And I'm going to share some numbers regarding breakthrough cases and reinfections to illustrate that point further. But again, making good progress. This is an update of our new confirmed cases in Travis County. You can see that over the weekend and for weekends in the future, we are not going to report cases. So all of those cases from the weekend, Saturday, Sunday, and Monday will all be reported on Mondays. So yesterday, our 3-day total of new cases was 105. So that brings our moving average down to 52, which is a 45% decrease since the beginning of May. So certainly impressive progress there. When we look at other communities that have achieved that 50% threshold or higher for vaccinations, it's about that stage where we see cases dramatically decline. So we were expecting that we were going to see significant decreases once we passed that threshold. I'm glad to see that we are, in fact, dropping cases rapidly. This is an update of our new admissions to the hospital. We had a great weekend with 13 admissions on Saturday, 4 admissions on Sunday, 7 admissions yesterday, which brings our moving average to 14. That's a 22% decrease since May the 1st. And I want to talk a little bit more about the admissions. We had noticed that our cases have been falling faster than our admissions numbers. In addition to that, we noticed that case numbers outside of the MSA, the Metropolitan Statistical Area, and beyond, and further out in Central Texas, those case numbers were increasing. The rates of active cases in the more distant counties are much higher, 3 to 5 times higher than the per capita rate that we're seeing in Travis County and in places like Williamson County. So that got us thinking, what is the influence of admissions from outside of the MSA? Remember that when we designed these tools, it was really to assess the impact on the hospitals. Now that the risk of overwhelming surge is rapidly dissipating, now our concern is, are we providing accurate information for our community in terms of guidance in the risk-based guidelines? So when we look at those numbers, and I want to thank Dr. Lauren Myers for putting together this graphic. What we're seeing here is the total admissions. The red are admissions from Travis County residents. The blue are admissions outside of Travis County, but within the 5-county MSA. And the green are admissions from outside the MSA. So that adds up to 100% or 1.0 on this graph. You can see that in the green area on the bottom, those admissions from outside the MSA, the impact of those admissions has been increasing over the past several weeks. In the past, it accounted for about 5% of our total admissions. Now it's been between 10 and 15% of those admissions. And when we look at transitions of stages, when we look at, in particularly the impact as our admissions go down locally, that impact is going to increase. Even, what we've been seeing normally between 1 and 3 admissions from this outside the MSA area, those are very impactful as those numbers drop in the overall admissions. To give you an idea of where those admissions have come from in the last 90 days, this is a heat map showing those admissions throughout the state of Texas. Again, this includes part of the time we were still in surge. So you can see some distant counties, including El Paso and the Valley in here. But you can see from the heat map that the largest impact for admissions for our hospitals within the MSA is from those counties which are immediately adjacent to the MSA. So again, some significant impacts that we're seeing from these outside counties. So when we take into account the impact over the past couple of weeks, that's what I'm showing you here. Our current moving average based on all the numbers of all the admissions to the hospitals in the MSA is 13.85 on that 7-day moving average. When we exclude admissions from counties outside of the MSA for the past 14 days, that drops the number to 12.71. Similarly, when we look at the impact over the past 14 days, under the current model, including those admissions, only 4 of the last 14 days we were under 15, or that stage 2 threshold. When we take out those outside admissions, 10 of the last 14 days were below stage 2. Now, because of this, because of the significant decrease in the cases that we're seeing, and later I'll show you the positivity as well as the other key indicators, we have made the decision to transition to stage 2 effective today. And I'll go through what that means in our risk-based guidance. But we feel confident that we are in a place where the stage 2 restrictions are appropriate. And that's thanks to the great work our community has done to continue the masking, continue the distancing, continue getting vaccinated. These investments are paying off by the decreasing numbers of cases and decreasing hospitalizations. This is an update of our hospitalizations. Again, the blue is showing our overall hospital bed utilization. The orange are ICUs, the gray are ventilators being used. Yesterday, we reported 85 individuals hospitalized from COVID-19 with a moving average of 101. Which is a 24% decrease since the beginning of May. Our ICU numbers, 29 yesterday with a moving average of 35. That's a 22% decrease. And our ventilators, 17 with a moving average of 18, a 25% decrease since May 1st. So again, making very good progress. We haven't had admission numbers in the 80s since the first or second week of October. So very, very good progress. Again, it's taken us 7 months to get back down to those levels. So we still need to be cautious. We still need to mask and get vaccinated, but certainly a better situation than we have been in the past few months. When we look at the hospitalizations overall for last week, 103 down from 135. That's a 24% decrease in the overall admissions week over week. So an impressive and rapid decrease. We can see that we've seen some further compression of some of these numbers by age group. Relatively stable overall in that 50 plus age group. We have seen the 50 to 59 group decrease. We have seen the 60 to 69 increase a little bit, 20 to 24 last week. But we are starting to see some compression in the younger age groups, particularly in that 30 to 39 age group. So again, we need to continue to see young people getting vaccinated. Young people, while their risk of hospitalization and death is much lower than older individuals, we still have, a dozen or more people in that younger age group, that 20 to 29, 30 to 39 age groups being hospitalized every week. So it's important for our success and for their own personal protection to get vaccinated. This is a breakdown of the hospitalizations by race and ethnicity. We see a significant decrease in the numbers of individuals from the Latinx community in the green hospitalized last week as compared to the previous 55 to 34. Relatively stable in our white non-Hispanic community, 41 to 46. And a decrease in our African-American community admissions, 22 to 16. Again, we have seen disproportionate impacts throughout the pandemic in our communities of color, and we will continue those outreach efforts. We'll continue the vaccination push in those areas in particular, and Interim Director Sturp will discuss that a bit later. This is an update of our positivity week over week, and I'm excited to report that for the first time since we've been tracking this data, we are under 3%. So 2.7% for last week, and that's with more than 9,000 tests reported in through our data feed. So a significant drop from the 3.6 the previous week. We anticipated that we would need to drop below 3% to enter into stage 2, and we're certainly seeing that align with the hospitalization numbers. So again, very excited that we are down that low at this stage. When we look at the positivity data by race and ethnicity, we've seen improvements across the board. Our Latinx community moved from 5.4% last week to 5.2% this week. African American positivity 4.7% to 3.6%. Our Asian American community 4.2% to 0.7%. And our white non-Hispanic tests 3.0% to 1.8%. So again, improvements across the board. We obviously have more work to do, particularly in our communities of color. So we encourage folks to continue to get tested. If you have any symptoms associated with COVID-19, yes, it could be a cold. Yes, it could be the flu. Yes, it could be allergies. But if we continue with the assumption that it's COVID-19, so that we can find out, we can quarantine, we can protect other members of the community, we'll continue to drive these cases and hospitalizations towards zero. So please get that. There are plenty of places still out there to keep free testing. So we encourage folks to do that. This is an update of the positivity by age group. Again, we see that relatively across the board decreases. Every age group is under 5%. We did see an increase in our younger age groups, in particular our less than 1 and 1 to 9 age groups. Again, these age groups, because they're smaller numbers of people and smaller numbers of tests, are more likely to have week-to-week significant variations. But again, it's also important to understand that individuals under the age of 12 have a vaccination rate of 0. So we expect that the relative impact of cases is going to shift younger as more and more people in the older age groups get vaccinated. Again, the risk is not dissipated in the same way for these younger age groups as it has for age groups where vaccination is available. So we have to continue to protect our young people. We have to continue to protect our schools, to protect summer camps, and those other places where young people congregate because their risk is not going away. This is an update of our positivity broken down by school age groups. So for our high school age individuals, positivity was 4.4%. Middle school, a significant decrease, 1.5%. We saw an increase in our elementary school positivity to 3.1% last week, and preschool 2.3%. Again, all of these groups are under 5%, which is great. But again, we have to remember that risk is still there for our school children. Those school children still need to mask. Those school children still need to avoid congregating in groups because that's where we're seeing transmission happen. This is an update of our long-term care facility dashboard. Again, we maintain low numbers in our long-term care facilities. Last 14 days, only 6 cases, 17 cases in the last 28 days. Again, we see some very small clusters in a couple of facilities. The vast majority of facilities have 0 cases. Again, as the CDC pointed out, this will be a place where masking and those precautions really need to stay strong because we have a concentration of people who are at high risk. We know the vaccinations are not 100% effective. So in circumstances like nursing homes, like long-term care facilities, like when you visit a loved one who has significant underlying health conditions, we need to consider stronger protections in those circumstances, even if folks are vaccinated. This is a new slide that I'm sharing, and this is related to our variants of concern that we've detected in Travis County. So you can see that the primary variant that we're seeing is B117. That's the UK variant. A total of 147 of those cases have been identified. One of those individuals has been hospitalized. The P1, which is the Brazilian variant, 3 cases, 0 hospitalizations. The 2 other ones are California variants, the B1427, the B1429, a total of 48 cases between those 2, no hospitalizations and no deaths related to those variants. So again, as we've seen over the past week, the current vaccinations, particularly the Pfizer and the Moderna, have shown to be very good against these variants. We're hopeful that we can continue to vaccinate people and drive down the risk of transmission so that we can avoid new variants forming and the introduction of other variants which may be more elusive in terms of the protections of the current vaccines. Now, this is a new slide as well related to breakthroughs and reinfections. So I wanted to provide this information, but I'll show you again the comparison between breakthrough cases and reinfection risk. So we have a total of 103 breakthrough infections from folks who have been fully vaccinated. That's out of 526,255 of our community members fully vaccinated. That's a rate of 0.02%. So very low rates of breakthrough infections. We did have 6 hospitalizations as a result of those breakthrough infections, all of those individuals over the age of 50, and have experienced 2 deaths, all of which were over the age of 70. So again, very, very effective protection against COVID-19, very protective against hospitalization and death. Again, the hospitalization and death numbers are not 0, so there is still risk, but it's certainly much, much lower than the risk of getting COVID-19. When we look at reinfection, these are reinfections which are still under investigation, so these numbers may change, but this is the data we have in hand currently. 387 potential reinfections identified so far out of 83,366 confirmed cases. That's a rate of 4.63%. So this is 200 times the rate of breakthrough cases. In other words, if you've had COVID-19 and you've recovered, you need to get a vaccine because you still have a significant risk of reinfection associated with COVID-19, even though you've had it. The vaccine is much, much more protective than the disease itself. So we strongly encourage those folks who've had it to get it. Out of those reinfections, 46 hospitalizations and 5 deaths. Again, significantly higher numbers of hospitalizations and deaths from those reinfections than from breakthrough infections. In addition to changing into stage 2 of our risk-based guidance, we have published our Health Authority rules. And I want to go through some highlights. It's 9 or 10 pages, so there's lots of details, but I want to cover some of the big areas here with you all. So we start out with some expectations for individuals, and this is individual behavior anywhere they are. For unvaccinated or partially vaccinated individuals, we expect them to continue to wear a face covering when they're outside of their home. So when they're in a public place, when they're visiting others, when they're at private gatherings, any of those circumstances, they should be wearing a mask. They should be maintaining 3 feet of distance from others. And that 3 feet is based upon the evidence that we have in hand, which is that in the presence of masking, 3 feet appears to be good enough protection for those who are wearing a mask. Again, there are circumstances where you may need to be more protective, but as a general rule, the 3 feet seems to be protective enough. Those individuals should also avoid large gatherings. Again, when we think about the ongoing risk, and I welcome CDC's sharing of their guidance and data, which is if you're vaccinated, you're very well protected. If you're not vaccinated, you're not. So the real risk right now for folks who are unmasked are to those folks who are unvaccinated. Yes, there's still a risk of breakthrough infections, but it's much lower than it is for folks who are unvaccinated. For fully vaccinated individuals, the expectation for our community is that they will continue to wear a face covering and or distance from others when there is an increased risk to unvaccinated individuals. And I'll talk in more detail about what we mean by that. So we've also broken it down to indoor and outdoor sites. As the CDC shared, there's certainly strong evidence that outdoor sites have much less risk than indoor sites due to the increased ventilation. So for outdoor sites, when there's less than 2,500 people gathered, those outdoor sites may implement a policy and post signs that fully vaccinated individuals can be present without masking. For gatherings that are 2,500 or greater, they must maintain a masking required position and policy, unless they receive specific written approval from Austin Public Health. Again, there are some circumstances where larger events may be able to offer this masking optional for fully vaccinated individuals, but due to the size and the challenges with obtaining accurate information about vaccination status and the higher risk associated with concentrations of individuals, it is going to be required for those gatherings that are over 2,500 for now. For indoor sites with less than 500 people gathered, so this is going to be your typical restaurant, shopping store, your typical business. If 500 or less people are gathered, that business may implement a written policy also impose signs where fully vaccinated individuals may be present without masking. If it's over 500 or 500 or more, they have to have facial coverings required, again, due to that higher risk. So there's some exceptions to these rules where masking is going to be mandatory regardless of the size of the gathering or size of the facility. The ones that are included in the health authority rules: hospitals, healthcare facilities, long-term care facilities, and congregate shelters. So these are homeless shelters. These are other shared living facilities where we have folks who may be more vulnerable than others. Also covered under other policy or law are jails and prisons, mass transit, including buses, trains, and air travel, as well as schools. Again, I want to point out and stress the importance of masking in schools. Schools are largely unvaccinated in terms of the students. We still have higher risk for transmission in schools. Yes, their risk is lower for hospitalization and death. But when we look at other countries that raced where we are, the real surge in cases they saw were for younger people, people under the age of 19, school-age children. So again, we need to continue to protect those schools, to protect those students in those schools, and continue masking in those circumstances. Again, the CDC in our focus is on three real situations where masking is more important. That's when there's high concentrations of high-risk people, nursing homes, hospitals, etc. High concentrations of unvaccinated people, like schools, and high concentrations of people, crowds, large events. So again, we've taken away the caps on events. We've taken away some of the restrictions. We've lightened the restrictions on distancing, and certainly believe that this is a measured step of relaxation consistent with where we are as a community. Again, we're hopeful that we will continue the progression down towards zero. And as we do, as we enter into stage 1 of risk, I anticipate that these rules will lighten further. I don't anticipate that we'll have the need to have these kind of restrictions for very much longer. But that depends on all of us continuing those protections, continuing to mask and distance where appropriate, and continue to get vaccinated, which is the best protection that we have. So again, we're moving to stage 2, having dropped below that 15 threshold and been there 10 of the last 14 days. That means that folks who are vaccinated for private gatherings can go without masks. Those who are partially vaccinated or unvaccinated in those private gatherings still need to wear their masks. For travel and dining and shopping, again, the masking depends upon the policy of where they are. For mass transit and travel, it's going to require a mask even for vaccinated folks. For dining and shopping, the mask depends upon the policy of the business that they're entering. So again, we need folks to continue those efforts. We need them to be respectful of the policies that are in place in the places they're visiting, because it is up to that business to determine. Just like if they require shirts and shoes to go in the shop, they require masks. You're required to wear a mask. If an individual doesn't wear a mask and a mask is required, they can be asked to leave. And again, we get back into that trespassing situation if an individual doesn't leave. Again, our community has done very, very well. They've been very compliant with these guidelines, and my expectation and hope is that will continue. These are the things that I just said. Again, I want to stress one other point, and that is that the safest position is vaccinated and masked. And I want to stress this because we're going to have folks who are fully vaccinated, like myself, who may want to continue to wear a mask in a public place. Maybe they want to ensure that other people around them feel comfortable with them being there. Maybe they have a high-risk medical condition and want to have that extra layer of protection. Maybe they have a loved one at home that is immunocompromised and they don't want to take that risk. It is okay for people who are fully vaccinated to continue to wear masks. That is the most protective thing to do. But our hope is that people will continue to get vaccinated, and as our situation improves, as our cases and our hospitalizations continue to decline, we can further relax these rules. With that, I will turn it over to Interim Director Adrian Stirrup.
Thank you, Dr. Escott. All right, good morning, everyone. Adrian Stirrup from Austin Public Health. First off, I'd like to give a brief update on our vaccine dashboard. These numbers represent the vaccinations delivered by community care and APH combined. So ending last week, we were at 13,115 doses delivered, and our cumulative total for the community, which we're very excited about, we passed our 400K benchmark with 174,000 vaccines delivered. Next slide, please. Our data from DSHS shows Travis County vaccinations by age, and you can see that our age for age 12 and up, at least 60% of our population has one dose, with 47.5% being fully vaccinated. For our age group of 65 and older, almost 81% have been vaccinated with at least one dose, and about 69% are fully vaccinated. Next slide, please. So just some updates on our operations. I know at the last session there were some questions about where we could tell the community to go to get their kids vaccinated. And so there are a few public operated sites. UT Health is one of them. The other is at the Travis County Expo Center. So encouraging parents to visit vaccines.gov for the latest information on clinics and pharmacies that are providing the Pfizer vaccination. Austin Public Health is in the process of preparing to be able to deliver the Pfizer vaccine. We hope to be able to do that as soon as the middle of next month. And if we are successful in receiving that authorization, we will be offering those shots at our Shots for Tots clinic. Next slide, please. No? Next slide, please, Dr. Escott. Oh, I can do it now.
Can you see it?
I can. I can see it, but it's not advancing. Oh, here we go. All right. So these are where our clinic locations are. You can see that we're still at the Delco Center. We're at Little Walnut Creek Library, and we are continuing our operations at the Southeast Library. Additionally, we continue to work with Travis County to set up vaccine pop-up clinics in the Del Valley area. Next slide, please. It's just not advancing. It's at the bottom. There we go. My computer is slow today. I apologize. And so a few events to let you all know about. We're going to be at Sacred Heart Church again this weekend on Friday and Saturday. I referred to the partnership with Travis County, so we'll be at Del Valley High School this Saturday as well. And last week we talked about an LGBTQ plus event at Givens, which was unfortunately rained out. And so we're hoping to be able to hold that event on the 23rd of May. All right, and last but not least, we really want to continue to encourage our community to come together to protect one another and be vaccinated. And who doesn't like a taco? So this Saturday, Torchy's Tacos is generously providing a free taco to the first 500 people who show up to get a vaccine. So I can't think of a better reason to come out and keep yourself safe and enjoy a tasty treat. And with that, I will turn it over to the commissioners and the council if there are any questions.
Thank you. Commissioner Gomez, do you have any questions?
No, sir, I don't have any. Thank you.
Thanks. Commissioner Trevelyan, do you have any questions?
Yes. Well, first of all, I would like to thank you for the significant work that continues to be done. When I looked at this number and I was fixated on 12, and I said 12-year-old. How many 12-year-olds? But I think this number is everybody 12 and over, not just 12-year-olds. Do we know the number for 12-year-olds who have been inoculated since last week?
So currently we are not able to present that data. The team is working on breaking it out by decade. And so once we were able to disaggregate it in that fashion, we to be able to share.
Okay, thank you. One quick thing. Have you all seen the COVID distribution and racial disparity study done by the Community Resiliency Trust? It was released last week, I think. If you haven't seen it, it addresses specifically what's going on the Eastern Crescent, and it lays out strategies for transportation, access, zip code specific strategies, and then other suggestions for collaboration. So I would really like to sit down and take the report and go through it thoroughly and think about things that we can do, particularly.
I am familiar with that.
They are familiar?
Right. Yes.
Your audio is kind of breaking up, Director Stirrup.
Okay. All right. Then what I'll offer then is I'd really like to sit down with you and work out specific things that we can do as we work towards Juneteenth events.
Yeah, I think she's having a...
Definitely. We have seen the report developed by...
All right, I think we lost her, but good point. All right, Commissioner Howard, do you have any questions? Yep, no questions. Oh, right on. Okay. So, Dr. Escott, are you able to hear me? Okay. Okay. Just wanted to go through a couple scenarios, if you don't mind, on mask wearing or not. I know the new rules might be confusing for some folks. I think there's been, with what the CDC said last week, and then what we're doing now, I just want to try to clarify a few things. Do you know, like a couple of situations? So if I'm walking down the street, so I've been vaccinated, do I need to be wearing a mask?
No.
Okay.
There's not a need for a fully vaccinated person, particularly if they're walking alone, to wear a mask. It may help you with your allergies, but COVID-19 protection is not necessary.
Okay.
Some folks will still want to wear a mask, and that's, again, it's more protective to wear a mask than not, even if you're vaccinated, but it's certainly not required.
Okay, and then I've got two kids, they're 4 and 6 years old, and if they go to a playground and there are other kids there, should everyone be all the kids be wearing masks, in your opinion?
Again, the most protective thing is to wear masks, particularly amongst individuals who are unvaccinated, and that's going to be everybody under the age of 12. It depends upon what kind of playground it is, whether or not it's classified as a site or not. I think it's wise for those neighborhood playgrounds, community playgrounds, other areas that neighborhoods may have, to post signs with those expectations. Those signs should say, if you're unvaccinated, please wear a mask. If you're fully vaccinated, you don't have to. And that's the minimum. Again, some communities may choose to still require masking for everybody, but what we've done is leave it up to those individual communities to decide if they want everybody masked or if they want to allow fully vaccinated people to go unmasked. Again, different businesses, different communities are going to make different decisions about that. Both options are safe in terms of what the current data is showing us.
Okay, thanks. And then, so my parents who are older and vaccinated sometimes quite often see my kids now, thanks to their vaccinations. Since my kids obviously aren't vaccinated, what's your thought if they're like indoors with my parents who are vaccinated, but still otherwise, I would say, at high risk because of their age? Is it best practice for the kids to wear masks in that situation if they're indoors?
It is best practice for them to wear a mask. Again, that decision is personal for individual families. Some families have a higher tolerance for risk than others, and some are, okay with accepting a little more risk. So again, that's an individual and family decision on whether or not those children should mask. It is safer for them to mask. Okay,
and then in general, indoors is still less safe, especially for people who are not vaccinated, and would be not a bad idea for them to still wear masks indoors, wherever they are, if they're with
That's right. The risk of exposure indoors is much more significant than outdoors. The more recent evidence, that we discussed a few weeks ago now, is that airborne transmission plays a larger role than we expected, which means that airflow and ventilation is more important than we thought, and distancing a bit less important. In that circumstance, indoor spaces, particularly indoor spaces that are poorly ventilated, are going to lead to higher risk for transmission. And that's why things like buses and trains and those really enclosed spaces with not great ventilation are still requiring masking as a mandatory policy. Similarly, in private settings, if you find yourself in those kind of circumstances, you need to use more caution.
Awesome. Thanks so much, Dr. Escott. Mayor, I will pass it over to you.
I appreciate that. Colleagues, we're going to go districts 1 through 10. Mayor Pro Tem is not with us today. Councilmember Fuentes.
Thank you, Mayor. So my questions are and thank you, to our Austin Public Health team for getting the vaccine map up on the website. I did find it and just want to highlight for anyone who's watching that is on the City of Austin website, where you can find a map that shows our vaccine clinics. I did want to add that we're still missing the pop-up vaccine efforts that the county is doing. And if we could get the Del Valley location added to the map, since that is happening this weekend, that would be helpful in getting that information out. One item or one comment I wanted to share is that we hosted a pop-up clinic at Hillcrest Elementary in the 4-4 zip code this past weekend, where the Del Valley Community Coalition advertised in advance that they would be handing out HEB gift cards. I believe there were $10, $15 gift cards. And that incentive worked really well in getting people out to this vaccine pop-up clinic. We had the feedback I received is that there were individuals who showed up to say, hey, we heard about this gift card. I'm here to get vaccinated. So just wanted to share that anecdotal note of this past weekend's effort. And I'm very happy to see that we have an incentive plan for Delco this weekend and offering that Torchy's gift card for the first 500. And so my question is around incentives, and I wanted to see if you could speak to a little bit more on any other plans that we have around doing incentives, any other strategies we can expect that our public health department will be proposing as we move forward.
Thank you, Councilmember Fuentes. Hopefully my audio is a little bit better now. Mm-hmm. Okay. So we are working with the vaccine team as well as our legal team to make sure that we are staying with
Stirrup, it's hard to hear you.
Parameters of what.
If you turn off your video, could you be heard better?
Acceptable for a city government, but yes, we do understand that we want to support.
Can you all hear Director Serp or no?
No.
Director Serp, if you turned off your video, I think your audio might be better.
Yes, that's off. If not, I can try to call in.
That sounded better if you could just keep talking. But we've lost what you said the last few minutes.
Oh, okay. So what I was saying is that we will continue to work with the vaccine planning team to figure out other ways that we can support and encourage our community to become vaccinated.
Director Stirrup, I missed that first part. I think you were mentioning that there was a restriction around municipal governments offering incentives. Could you speak a little bit more to that? And I just want to highlight for the public that, you know, we see the news headlines. I believe the state of Ohio is offering a lottery. You know, if you get vaccinated, you get enter into a $1 million weekly lottery. And so certainly other governments are moving towards this effort and offering incentives. It would be wonderful if our Texas legislature also would put some attention to this, especially since we are in a legislative session. But if you could speak a little bit to any restrictions at the municipal level that we're encountering.
What I said was that we want to work with our legal team to make sure that we are within, you know, good guidance and good practice for a local government. But we do hope to. Your attendee ID number followed by pound. We do hope to continue to work on incentive plans. I'm sorry that my video and my audio is not working for me today.
Again, Councilmember Fuentes, it's important that we find the balance between encouragement and coercion. And I think that's what we're seeing some of the criticism about the Ohio system. We want to encourage people. We don't want to, but we still need them to make a free and informed decision about what to do. So I think that's that's part of what we have to do is find that appropriate balance.
Thank you.
Thank you. Councilmember Renteria.
Thank you, Mayor. And Dr. Escott, can a parent get a contract the virus and if they're vaccinated and if they're vaccinated and they go and home with their children, can they also be a carrier? I mean, can they on them? I hear different reports saying that if you're vaccinated, you're not gonna, it's not gonna affect you and you're not gonna have it, so that you can the possibility of transmitting it to your parents. I mean, to your kids. What's the standard on that? I mean, do you have any opinion on how parents should handle that?
Yes, Councilmember. First, I'm just going to share something real quick to clarify some comments and numbers from earlier. If y'all can see that, when I spoke earlier, I reported the reinfection rate at 4.6%. It is 0.463%. So more than 20 times the breakthrough rate, but I did want to clarify that particular number. When we look at the risk of exposing others once you've been vaccinated, the data is still being gathered, but I will say this. There are certainly indications the viral load for individuals who have had a breakthrough infection is much lower than folks who have been unvaccinated that have had the infection. So that means a decreased risk of transmitting to others. Is it possible? Yes, it's probably still possible for those breakthrough infections to cause infection in circumstances, but it's much less likely, which is why the CDC and why we have relaxed those standards for fully vaccinated people, because the risk is very low. Again, if your tolerance for risk is closer to zero, wear a mask in addition to the vaccine. If the risk, 90% risk reduction is enough for you, then vaccination alone is probably okay.
And the reason I asked is that, I have great grandkids that I go to visit now and it's always in the back of my mind saying, should I hug them and kiss them, and after I've been out, and with a walking or being inside a restaurant or something like that, and then coming back and, visiting your family, they have young children, and that's always a big concern of mine. It's back of my head. What do you suggest? Should I go out there and hug them and kiss them, or should I just wait back? And how many days should I wait until I go out there and do that?
So again, Councilmember, for fully vaccinated people, again, it depends on that risk tolerance and the value of that hug and kiss. I think that's worth a lot. So I'd be willing to take the risk. Others may not. But it's important to note that the vaccine, this is real life data. This is post-study data. It's 90+% protective. It's 50% better than the best flu shot that we've ever had. That's how good these vaccines are. So, people who are fully vaccinated can start to behave in a way that they would during flu season, depending on the allowances, when they're in public places, depending on the allowance of the particular business that they enter. But privately, it's going to be more like flu risk in terms of those individuals who are fully vaccinated.
Thank you for that.
Councilor Kassar.
So I had to miss the first 9 minutes of your presentation. So tell me, I hope that my question isn't something that you presented right at the beginning, but did you all present demographics or geographic wise who it is that APH has been vaccinating most heavily here in the last couple? since we pivoted to the less mass vaccination and the more targeted vaccination strategy? I'm assuming no, because I think I missed the beginning of Dr. Escott's presentation.
Councilmember, I did not speak about the demographics of the vaccinations. We do have that on the dashboard. I don't know if we have it broken down by the last 2 weeks versus, the previous vaccination effort, but we can certainly try to retrieve that data for you.
Yeah, no, I think it would be useful. I don't think you have to do it every time, but I think it would be useful to present in one of these work sessions how things have shifted from the mass strategy to lately. And looking at the dashboard, it seems like, and it's a little hard to tell exactly the dates, but it does seem like the places that most vaccines are being distributed that are being tracked here by APH and community care are in 78753 and 58 and 44 and 41 and 04 and 45, in some of the places where we know that there's been less vaccines and we've had a lot of high risk individuals and cases and deaths. So I think as we pivot the strategy, it could be useful to show what our role is and how well we're doing it, so that one, we can be accountable towards doing it better, but two, if we're reaching those goals, and indeed my look at the dashboard shows that that's what we're doing, I think that's important to show as well. Because I think you were showing that as we were doing the mass vaccination strategy. I think we saw some of the skew towards certain zip codes. And now I think as you're doing the more targeted strategy, it seems that at least from the dashboard, it looks like you are hitting some of those zip codes that we're getting less. So I think just a presentation on that or some clear info beyond the dashboard could be useful, so that we're not reading between the lines, but really being able to ask you questions and see that data.
And we'll work on getting you that data. Councilmember, I will say, and one of the reasons why I presented the breakthrough and the reinfection rates, which are 20 times higher than the breakthrough rates of infection, is my concern is that because those communities of color have been hit so hard by infection, that there may be the misperception that people who've had infection don't need the vaccine. And that is absolutely not the case. They're, again, more than 20 times as likely to get the infection again than if they get the vaccine. So it is really very important for us to all share that message that even if you've had COVID-19, the vaccine is better. The immunity is better. It's more comprehensive, and we need to get those folks vaccinated.
I think it's a really strong fact to share that it's 20 times better. And I think that paired with the targeted strategy that we're pivoting towards, along with whatever incentives we're legally able to thoughtfully do, as Councilmember Fuentes mentioned, I think will go a long way. So thank you for including that reinfection and breakthrough case data. And then I think Director Stirrup, whatever we can do to show what the pivoted strategies looked like in the last few weeks, that would be great. Thank you. Unless Director Stirrup, I know you're having some trouble with your audio. Do you have any facts off the tips of your fingers? I don't want to bump you to later if you have anything now.
I don't hear her.
That's okay. Thanks.
Thank you, Councilmember Star. Councilmember Kitchen?
Yes, thank you all very much. This is, as others have said, and Dr. Escott, this is good news for us. And if we can continue really pushing the vaccinations and being, careful about when we mask and unmask, I think that we can continue on this trajectory. I just have one follow-up question. And I know it's something I've been asking about, and I just want to see what y'all's current thinking is on it. We had had some discussion about the usefulness, or whether it would be useful to do. So we started talking about it as reverse 911, and then went to a perhaps another approach. but I'd like to understand your current thinking on more targeted outreach or more specific outreach through a mechanism like that. I know it was something that you all were looking into. Can you tell me the status of that?
Councilmember, I'm not sure of the status of that. It looks like Director Stirrup is still having troubles. I'm going to ask ACM Hayden Howard if she might be able to comment on that.
Good morning, Stephanie Hayden Howard. Our staff have done some additional kind of due diligence. One of the things that, as we're working with the 7 outreach organizations that we have on contract, as well as the ones that United Way has on contract, it's essential for us to really be able to get that information from those, from the people that they're working with. It seems to us that that is a great target for us to be able to reach out to. And so our staff in that meeting that they're going to have, the joint meeting, as I stated last week, United Way joined us with our 7 outreach providers. And so now they're going to convene a full meeting with all of the providers there, because that is going to be able to help us to be able to move that forward. We do have a couple of mechanisms that staff have identified that we have used thus far. And so being able to get those phone numbers from individuals and being able to text them. So being very comprehensive, kind of moving even beyond technology. The door-to-door is also a method that they are using. They're going door-to-door because even though a lot of people have cell phones, a lot of folks are not wanting to be forthcoming to give their phone number away because of all of the folks that are kind of calling randomly to phones anyway. So it has to be a combination of those efforts. So we'll have more information after that meeting occurs and what that strategy looks like and how many folks that we will be able to reach out through with that method.
Okay, thank you. The reason I keep asking is, and it sounds like maybe you all are thinking this is not an approach that is a high priority approach, and that's fine. But the reason I keep asking is that, that's what we did during the winter storm. We actually worked with a volunteer group and made hundreds of phone calls and text, because that data is publicly available, those phone numbers and things. And so I'm really just wanting to understand. If you all think it's not something to pursue, then okay, I understand that. I think the more targeted efforts you're making right now are important. I just think that those are not going to reach the whole community, and that, once or twice or maybe 3 times some kind of push outreach to people through texting or through automated phone calls or something like that is cheap and easy to do, and perhaps it would be helpful. I'm just wanting us to do everything we possibly can to continue to push. I'm very happy about the 53% that we're at right now, but we know that we need to continue to up that in our community, particularly with, concerns about the potential for variance in the future. And I'm just not sure. Maybe we can have an offline conversation about it. We've been talking about this for a number of weeks. And like I said, I certainly understand if you all think it's not something that's going to produce much, but it just feels like we're not doing everything we possibly can to do that kind of outreach. So I'll reach out to you offline and to understand this better. Thank you.
Thank you. Councilor Kelly.
Thank you. And thank you for that presentation about where we're headed and what's happening regarding COVID-19. I'm very excited that we've gotten to where we are, but we do need to remember to still be careful. My question today actually has to do with a little bit of a conversation Dr. Escott and I had last week. I'd like you to help us understand some of the outreach that's being done to help get vaccines to individuals in our community who are experiencing homelessness, how that's going, and what it looks like now.
I can jump in a little first, Dr. Escott, and then more than happy to have you catch up, joining from my phone. Hopefully everyone can hear me clearly.
Yes.
Great. So initially we have partnered with Community Care and their team that provides services at the Arch to vaccinate the guests staying at the Pro Lodge. And we are working to expand those efforts for those who are experiencing unsheltered homelessness. I can come back next week with numbers, but I'm not sure that we can pull the data that way, but I can ask the team. But we will continue to expand those efforts with Community Care. And as we shift away from mass vaccination clinics, we'll use our mobile strike teams to partner with hosts and PATH and partners who do outreach in that space to provide vaccinations for those who are willing.
And again, I don't have much to add to that. It was a great summary from Director Stirrup. We have worked hard to protect our population of individuals experiencing homelessness. I think we've done much better than many other cities whose populations were devastated by COVID-19 early on. And we learned lessons from those who faced surge before we did. As we look at a shifting situation in terms of our population of individuals experiencing homelessness, I think it's an opportunity for us to provide that outreach, particularly folks, as they're moving locations, to offer that vaccination as a opportunity to decrease that risk of transmission. Again, we've done well so far, but we've got some more work to do. We certainly have hesitancy among our population experiencing homelessness, so we are working on strategies to find out how we can encourage folks further to get that vaccine.
Great, thank you so much.
Thank you. Councilor Poole.
Thanks a lot, and thanks to everybody who's working daily on these front lines. I appreciate the continued diligence and excellence. I have no specific additional questions. Thanks so much.
Thank you. Councilor Ellis.
I would love to know more about children under 12. Is there any updated timeline of when the next age group might be cleared to start getting vaccines, or all the way down into the little ones? Is there an understanding of when everyone might be able to get a vaccine, no matter what age?
Well, it's still up in the air for younger kids. Again, the burden for safety is higher as the risk goes down for the actual disease. So we expect it's going to take longer to get to the younger ages than it did to move from 16 to 12. Having said that, those studies are underway. I think we may continue to see drops in age groups as the summer goes on. I think it's likely that the children down to age 2 will have an option for a vaccine by the end of the year. But again, those timelines are not clear or solid right now. So again, when we look forward to the next school year, what's it going to look like? I think for middle schools and high schools, it's going to look relatively normal, depending upon our success at vaccination over the summer. Certainly there's enough time. We've got about 60,000 kids between the ages of 12 and 15 who were, just became eligible. So relatively small number, a number that we could do in a single week in this county. If we work hard, if parents work hard to take their kids, like I'm going tonight to take my son to CVS to get his first dose. If we do that now, then school year next year looks relatively normal, particularly for those older kids in middle schools and high schools. younger children, elementary schools, preschools, there may still be some precautions in place where appropriate to try to reduce that risk of spread.
Thank you for that. And I have appreciated all the questions where people are trying to figure out how they interact with kids young enough not to be vaccinated when they're vaccinated. I personally am happy to keep wearing my mask in public when I'm with people that aren't in my pod. This last year has just taught a lot of us about how much coughing and sneezing has been spreading all sorts of viruses. And I'm more than happy to keep wearing mine until to make sure that everybody can be safe and everyone qualifies for a vaccine.
Councilmember, I think, love your neighbor is a universal truth. And that's what this is about. That's what we're talking about now. What can I do to be neighborly? It's got less to do with, with individual liberties and some of the stances that have been taken. This is about love your neighbor. If you don't want to get vaccinated for yourself, get vaccinated for your neighbor, for your mom, for your dad, for your kid. It is a remarkably good vaccine and a remarkably safe vaccine. And, if we can really embrace love your neighbor, we'll get through this quickly. And we will be free from health authority rules and masks and so forth. But not until we're all there.
Completely agree with that. Thank you.
Thank you, Councilman Tova.
Yes, thanks. I just wanted to say that my teens are among that 60%, and I'm just so absolutely thrilled to have that new age group of 12 and up be eligible for vaccination, and to have so many avenues for getting vaccines among that age group here in our community. And I just want to give a special plug to those in that age group. I mean, I was really amazed as soon as that changed, just to see on my daughter's social media the number of kids who were sharing that information about where kids could get vaccines and those opportunities. And just anecdotally, I know within a day, one of my daughter's circle of friends had all gotten vaccine appointments because of that kind of sharing of information. So let's, as we need to continue getting that message out among youth, some of our young people may help us in that and could be good sources of information. I did want to say, I had a quick question back to Judge Brown's. Oh, and I want to just pinpoint that and say how important it is. We are all beginning to see the end of some of the isolation that's and some of the quarantining and the other requirements during this period of time, but we are by no means in a completely safe place yet. Both of my daughter's schools sent out COVID notices yesterday. So, as we continue to get more and more vaccinated, it just is so important. So Dr. Escott, Director Stirrup, thank you for continuing to emphasize the need for precautions and safety, even as more and more individuals in our community are vaccinated. I want to get back to Judge Brown's scenario, and thank you for running through those. I think those are answering a lot of the questions that many in our community continue to have. In that scenario where the parents are vaccinated and unvaccinated kids, and Dr. Escott, you responded that it is probably better to mask inside. In that situation, is the recommendation that it's better to mask for the parents' protection or for the children's protection as they're unvaccinated, or both? I think that's getting kind of confused in some of the conversations in articles and other advice.
That's a great question, Councilmember, and thank you for bringing that up. When we talk about kids and parents in the same household, you have unavoidable risk there. So masking around your own children is not going to be that helpful because of this airborne primary method of transmission. When you're talking about visiting other children, grandchildren, or people outside your household, that protection is really, it goes two ways. Number one, the vaccinated person can still get it and spread it, particularly if the contact is close and prolonged. But if you have an individual who's at higher risk, who's vaccinated, there's still the risk of breakthrough infections. So when those individuals who are fully vaccinated and high risk are around those who are more likely to be infected now, they should consider an extra layer of protection because there are breakthrough cases. There are some circumstances where individuals should be more worried about that. So if they're immunocompromised, if they're taking immunocompromising drugs, if they're on chemotherapy, those are situations where the vaccine may not mount a significant immune response for them, so they may not have the same protections as others. For these kind of situations, it's important for folks to have that conversation with their physician about their particular situation, which may provide advice. I'm sure that advice will be wear a mask in addition. In some circumstances, individuals can receive antibody testing to test their level of immunity after the vaccine happens to see if it was a successful vaccination series. So for folks, particularly immunocompromised folks, they may want to consider that as an option to discuss with their physician.
Great, thank you. And I should have said it was the grandparent. The scenario I was asking about was the grandparent and the kid, but I think it still holds that you're really protecting both parties in that, both the unvaccinated children as well as the grandparents who may be at higher risk, even though they are vaccinated. Is that accurate?
Yes, and again, when we see the breakthrough cases, the hospitalizations and the 2 deaths, those are in older individuals. Deaths in individuals over the age of 70, I think both of those nursing home residents. So again, yeah, use more caution in those circumstances.
Thank you. Councilor Alter.
Good morning. I got an email this morning from LBJ LASA that they are, opening up more appointments for the vaccination today. Walgreens is providing now up to 1,000 vaccines today because the demand is so high. So that's great. I'm very excited that the parents and the kids in those age groups are stepping up. I had a 2-part question. First was if you could speak a little bit to how APH or the county is working with the schools to coordinate those vaccine clinics. And then secondly, I'm hoping you can provide some additional guidance for businesses that are trying to decide how they transition from the mask mandate to this new world. We do not have vaccine passports. People do not wear a thing on their head that says they were vaccinated. So can you provide more guidance, through this conversation? And can you also detail what kind of guidance the city plans to be providing or has provided that I may have just missed?
So I can answer the first part, Dr. Escott, about the partnership with the schools, and then I'll let you take it away about the guidance. And so as part of the social service branch under the Emergency Operations Center, the Child Care Schools Task Force has reached out to and surveyed the local AISDs, all the public schools, including charter schools, to see if they would be willing to partner as a vaccine site. And we got, of course, a lot of takers on that. And so now we're working through our partner providers to see who will be able to actually provide the vaccines. We do have one contract with a provider who is experienced with Pfizer. And so we will leverage those services or that contract to begin, partnering with schools to be hubs or vaccine sites. And as we come online, we'll be able to do some of that, but our plan really is to engage our provider community to match up with those schools who say they are ready and willing to be vaccine sites.
And I'll respond to the second part of your question, council member. And we will have some FAQs coming out this afternoon to answer some of those commonly asked questions. We left it open to businesses for a couple of reasons. Number one, our stance is that masks in public places, vaccinated or unvaccinated, are still required, indoors in particular, as the default position. Because it's important to know that we are not there yet to go to a masks optional situation. So masks are required. If a business decides, then they can implement a policy and post signs about their policy. And I think the decision for businesses really depends on the nature of their business and their clients. So businesses that that cater to unvaccinated people. So businesses right now that are primarily focused on children, it's probably wise to have a everybody mask policy because you're going to have a large number of people who are vulnerable to COVID-19. If your business caters to high-risk individuals, it's probably wise to continue to have an all-mask policy. If your business involves interaction of individuals face-to-face for longer durations of time, barbershops, beauty salons, nail salons, these kind of things, it's probably better at this stage to continue an all-mask policy. So it depends on a lot of factors, and we want to leave that up to the businesses to decide what is best based on their business model. I think right now, the status quo has been masking. I think people, to a large extent in this community, would be okay with continuing that for a little while longer. So, I think it's also part of reading their customers. And certainly if they get an indication that a significant majority of their customers are fully vaccinated, they may consider that option for their particular business.
Okay. I want to just begin thanking Dr. Escott. You're not long for these meetings and talking to us, but you've done just an incredible job over the last year plus. So thank you for that. Good to have Director Stirrup in her new role joining us, and welcome home to Dr. Walks. So I gather, that at a really high level, the presentation today going down to risk level 2 is another indication just how well we're doing as a community and the vaccination is doing. It's just a real reminder just how effective the vaccine has been, and we're all should be celebrating that, as well as how well we've done as a community with a mortality rate that's as low as it is. So I guess what your new rules say basically is that most places can choose their own mask rules. Good news sign saying anyone vaccinated is protected, but sadly, unvaccinated people are even greater at risk, especially in their places where people aren't masking. We're talking really about children under 12 in communities that disproportionately of communities of color who remain unvaccinated. So the new rules balance freedoms for vaccinated people with increased risk to those who aren't by letting businesses and people and their customers make choices. So generally speaking, business can make choices, but there are some parameters you placed in that. Do I understand correctly? Gatherings over 2,500 people, just by rule, people would need to wear masks if they're outside. Gatherings over 2,500, and inside gatherings over 500 need to be wearing masking. Below that, businesses can make choices, and then people can make choices about where they go in. I think that's pretty straightforward and will be good, and I appreciate you continuing to do that, and the new risk chart getting out I think also helps. I don't have any further questions, Judge. I think we'll turn it back over to you.
Thank you, Mayor. Yeah, thank you, Dr. Escott, also for all of your help. It's been great working with you in this capacity. Look forward to working with you in your new and returned capacity going forward. But you've really been a great partner in all of this. Thank you so much. With that, we will adjourn the Travis County Commissioners Court for 5 minutes and come back at 10:30 after the mayor, after you do similar with the city council.
That sounds good, Judge. Thank you. I have us at 10:30 now, and we're going to adjourn the joint session. We'll reconvene or convene our special call, our regular work session. And let's do that at 10:40. At 10:40, we'll be back on that other channel. Judge, Court, thank you.
Thank you, Mayor.
When I fall away, making the same mistakes what you do. When I fall away, making the same mistakes. What's happening?